and good evening and welcome everyone to Equal Hope. I want to thank you right now for joining us today. As usual, I have an amazing show with an amazing guest, and I'm so glad you had some time out in your day to join us. I'm Dana Devine. I'm the Community Engagement Specialist at Equal Hope. Equal Hope is a nonprofit organization right here in Chicago, and we are tasked with eliminating health disparities right here in Illinois. We do this by offering free services such as free cervical cancer screenings, free mammograms, and we will get you into a primary care, your very first primary care appointment for free. And that's really important because you got to have a baseline, and that's what your primary care doctor will establish for you. We have all types of services that we offer. We can help you with your flu vaccines, COVID shot. We can link you to a medical home. So many services, and all you need to do is give us a call, 312-942-3368, or visit equalhope.org. I encourage you to write that down. Sometimes this information isn't for you. It could be for someone you love. And pass the information along. Information is power. We're on TikTok, you guys, Facebook, Twitter, Instagram at equalhope_IL. Keep that in mind. If you're a cancer patient, a cancer caregiver, a provider, we have resources right on equalhope.org. Please stop by, get some information, and pass that information along. There's a new COVID-19 page that's up, and as we see those numbers rising, that's pertinent information. Stop by. Today we are talking to Dr. Renee, the beautiful Dr. Renee. She is a medical media personality. You probably know her, have seen her already. She's an author and a host, and I want to thank you right now for joining us, Dr. Renee.
Thank you for having me.
And you know, this half hour goes so fast. So let's get right into it. Today we're going to talk about asthma. I found a beautiful quote: "Living with asthma doesn't define your breath. It defines your resilience in every breath you take."
I agree.
Yes.
I like that.
And so here we are today with Dr. Renee. Dr. Renee, talk to us. Tell us about yourself, and why are we talking about asthma today?
So I am a medical doctor. As you said, I do media full time. So I talk about health on TV, radio, print, and online media. I was born with asthma and allergies, severe food allergies and environmental allergies. So that's why we're talking about asthma today. I actually currently have a show that's in 45,000 doctors' offices across the country. And that show is in the waiting rooms on the TVs. And right now, they are showing my asthma journey, which we shot right here in Chicago. It's got some footage from the Hyde Park Records and some other places you'll recognize. I was running in Washington Park. And yeah, so that is my asthma journey. That show is actually like a 4-minute show. My usual show, Keeping It 100, is 100 seconds. And we did a man on the street on the north side outside of a coffee shop talking about mental health in the Black community.
Very important.
Yes.
Very, very important. So how would you describe asthma to someone who isn't familiar with it? I mean, we've heard it, and if it doesn't,
Yes.
it's not in your family, but tell us how you...
It's a serious disease that affects the lungs. So that's how I would describe it, because unfortunately, a lot of people hear the word asthma and they don't take it seriously, but there are a few things that you must do in this life, and breathing is one of them. And if you can't breathe, how are you going to live?
Right.
So that's why it is serious. It's not to be played with. It's serious. And people have died from asthma attacks. So.
Are you asthmatic?
Yes. Yes.
Born with asthma?
Born with asthma.
Okay. So symptoms of asthma, in case somebody right now doesn't know what that feels like, what should they be looking for?
So asthma attacks, tend to happen at night. So if your child wakes up in the middle of the night coughing and saying they're having trouble breathing, then of course there is exercise-induced asthma. You've got a child that runs track or just horse playing, with their family and friends, and they can't catch their breath, and it takes a really long time for them to catch their breath. You might want to bring that up to the doctor. Also, of course, there's allergies. So if your child plays outside and comes back inside and is having sneezing and all sorts of issues, maybe their eyes are turning red or whatever, they might have allergies, and that could be part of their asthma symptoms. And then, of course, food allergies. So if you eat something and all of a sudden you start to get very warm or your tongue is itching. I used to say my throat would itch. These are signs that your child could be having an anaphylactic reaction to the food, and anaphylactic reactions would I have asthma attacks with mine, so yeah.
So these are symptoms.
Mm-hmm.
So the first, everybody who starts to feel like they're not breathing well, that's not necessarily
no.
asthma.
No.
So any other pre-markers?
So the thing is, like, a lot of people think, oh, he just has a cold.
Right.
Okay, but if he has a cold for a long, long, long time, because as you know, colds come and go, few days, not a week, not 2 weeks, then you might want to consider going to the doctor and seeing if it's asthma. And then also, their children usually, even with a cold, it might be a runny nose, it's not a big deal, not having trouble breathing.
Right.
And so if your child can't talk to you, and then also, like with me, you can see when I'm struggling to breathe, there's like an extra vessel that pops out over here because I'm working so hard and my back starts hurting too. And so these are things that your child probably could actually tell you, but you just may not realize that that's what's happening. Is they're having trouble breathing.
And so why, you said a lot of attacks, it's common for an attack to happen at night.
They haven't figured it out.
Okay.
But they're working on it, though.
You knew the question was coming.
They're working on it. But yeah, because I've written 2 books. One book is about food allergies, a children's book, and then the nonfiction book I wrote was about asthma and allergies, and I was trying to find that information to include in the book.
Yeah. Are there different kinds or different types of asthma?
Yes. So that's, like I said, there's exercise-induced. And then there's, like some people seasonally will get sick. And so it's not necessarily...
Is that asthma or allergies?
The allergies, though, if they get exposed to that allergen, they'll have an asthma attack. So they don't get sick all the time. Yeah, and they probably might not need to take medication year round to not get sick, but they need to take it seasonally. And then there's a bunch of different types. Eosinophilic. There's it gets very.
That's okay. Give us a few names. Yeah. Don't scare us, but
eosinophils are the type of cell that are involved with allergies and stuff, and that's another type of asthma. And actually, the commercials on TV for I can't remember which drug it is, you'll hear them say eosinophilic asthma. Yeah, one of the new biologic drugs that's what it's for.
Ooh. Okay, so how do we manage asthma?
So, there are so many amazing drugs on the market, and then...
Well, if you don't know you have it.
Right. So you go to the doctor. And if you tell your primary care doctor, the pediatrician, usually childhood asthma, children are usually diagnosed young, but you can come up with asthma later in life as well. So if you tell your symptoms to the doctor, then they should refer you to either a pulmonologist, who's somebody who studies the lungs. The pulmonary system is the lungs. That, or an allergy and immunology physician, who is someone who is specific to asthma.
Okay.
Yeah.
So what's the percentage of adults that get asthma later on in life?
I don't know the stats, but I do know that it does happen. Yeah. And then actually what happens too a lot of times is that adults, no one ever told them that they were allergic to this or that or whatever, and so then they end up having it and they have this asthma attack and they're just like, I don't know what happened. All of a sudden I couldn't breathe. And so it was something that they, I guess, always had this problem, but no one ever quite told them what it was. The other thing I've also noticed is that a lot of people are told they get bronchitis every year, but it's not bronchitis. They actually have asthma.
So the cough.
Yeah, the cough and, the mucus buildup and stuff that comes with that. Yeah. So
should asthmatic people refrain from mucus types of foods?
If you can, yes.
If you,
because I will admit it, I was a milk drinker. I loved my skim milk, and then I decided I wasn't going to drink it for a while, and I didn't even notice what happened until I went back to drink it, and I started, and I was like, what is going on? And I go, oh my God, that's that inflammation. Because all of a sudden I was clearing my throat and I had phlegm again. And I was like, when I went without, I didn't have that problem. So I'm an oat milk girl now.
So I remember my best friend when we were young, she had to get every week she went for an allergy shot. And we would I'd walk with her, and she'd go in, and you didn't even think about it. It was just a routine she had, right? So what was the goal of those shots?
So I will tell you, I had allergy shots. I think I started around 6. I had them like 3 or 4 years, and they were for my environmental allergies. And I will tell you that they worked, because to this day I can go outside and be on the lakefront right after they mowed the lawn, and I don't have a problem. Oh. I don't get, you know how some people get that sinus infection every year at the same time. I've never had a sinus infection. So the allergy shots, I'm a huge proponent for them, especially if you start them young, because they literally took care of my environmental allergies.
Forever.
I have, knock on wood, we haven't had to have a re-up. I'm good.
Okay. And how long was that run? 6 years?
I think it was like, I think it was like 3 or 4 years.
Okay, and so those shots reduce...
They give you, what they're doing is introducing your body to the allergen, just a little bit at a time.
Oh.
And trying to get you, so that your immune system isn't fighting it anymore.
And can tolerate.
And can tolerate it.
Right, I guess I didn't really, because it wasn't like she was going while she was in an acute...
No. And I don't think they'll take you if you're sick. I think because I didn't go to the doctor. My mom was a medical professional, and our doctor...
You got the shot at home.
Yeah. Our doctor was like, you can give them to her. And so I didn't go to the hot doctor because the other thing, because my mom was a respiratory therapist, the reason why you have to go to the doctor is because if they give you that little bit and you have an attack, someone needs to be there to take care of you, so you don't die. My mother could do that. My mother actually performed CPR on me when I was a child and brought me back to life. So she knew what to do. She could handle it. So
yeah, that's really scary that when you don't know that your child has a food allergy. Like my daughter has a huge peanut allergy and has had to be rushed to the emergency room because some dishes have, and you don't know. She doesn't know. And that is very, 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 very scary. And so allergy and asthmatics should very well be carrying this EpiPen, right?
Yes. Well, it's an epinephrine auto-injector because EpiPen is a brand.
Okay.
I carry Avicue, which is another brand, but it's got epinephrine, same thing.
Right. And that's more allergy related.
Yes, but it depends. So one, I will tell you, and I don't know the stats, but there is a high probability that if you have severe food allergies like that, you probably do have asthma as well. Mm-hmm. My food allergies, I will have an asthma attack. So that's why it's very important that I carry one, because if I, introduced to my allergen, I could stop breathing.
So if you see someone that is in the middle of an attack, what should you do?
One, ask them, do they have their inhaler? Because hopefully they're not so far gone that they can't use their rescue inhaler. So rescue inhaler is just like it sounds. It's to rescue you if you're having an acute attack. This is not something that is a long acting. This is a rescue, let's hurry up right now. So hopefully they have that. If they don't, then you need to start asking questions and calling 911 and figure out, how to get them some help. Because, like I said, not being able to breathe is rough. And then I think because I've had it my whole life, the times that I have had issues, I'm very calm about it because I know what's happening. I know what to do. But some people, on top of the fact that they're having this issue, now they're not calm, and that's making it far worse. And so the clock is ticking. Like, you need to get them to an ambulance, because they're going to need oxygen. They're going to need, and if you don't have a breathing machine available, because that is the one thing. If you can't use your rescue inhaler because you just can't breathe and you're that far gone, you can at least use a breathing machine, the nebulizer. But if you don't have one available to you, then you need to call 911.
And I had a cousin who died at 7 years old at school because he had a peanut allergy and they didn't get it in time. That just came to mind. So it's very important it's so hugely important to know about your children's food allergies.
And in our community, unfortunately, there's a lot of people that are going undiagnosed with asthma and with allergies. And both of them are very serious because, like I said, if you don't know that you have asthma, then you'll walk into your triggers. Asthma triggers could be, like I said, anything in the environment. Right. So it could be dust, it could be pollen, it could be dogs, it could be cats.
Right.
It could be the asbestos that's in the old buildings.
Right.
Roach dander. Anything that's environmental. Then it could be any food. I have heard the oddest food allergies that I thought were odd, but that's what that person's food allergy was. Like I heard somebody who's allergic to bacon. I'm not joking.
How could it be?
Right. But so that's really important. And if you don't know, that's when you get in trouble. When you don't know.
Okay, then this is where disparities, I would imagine, comes into play. Mm-hmm. So I was able to have my daughter tested at a very young age. When we recognized the peanut allergy, she had extensive testing with the market, the 20 things. Does everybody get that?
No. Because you have to go to an allergist to have that done. So what I've discovered is that, and this is why I wrote my book too, in my book I literally said these are the types of doctors, because I met so many adults that didn't know about a pulmonologist, but they were asthmatics. Didn't know that, so they just went to their internist. And I mean, my colleagues in IM, they know their stuff, but this isn't their specialty.
Right.
And if you go to a specialist, that specialist has gone to all sorts of conferences to be updated on the most recent and best drugs and best protocols. And so it's better for you to go to the person who is specialized in it. The allergist is the only person really is going to do an allergy test. Now, there's this allergy thing I've seen on Facebook. I don't trust it because it's some home thing you can do yourself.
I haven't heard of it.
I've seen it way too many times in my feed. Go to the allergist. If you can, ask your doctor for the referral, go to the allergist. Here in Chicago, Mobile Care Chicago has a van that goes into the community. So they go into the communities like Inglewood and, communities where there's a large population of Black people. And they have doctors on the van and respiratory therapists, and they are treating kids.
Well, so what's the difference between a food allergy and food intolerances? Because people are walking around saying, that just cabbage just makes me gaseous, or it makes me don't feel good, and not recognizing that is sending you.
Right. So food intolerance is you can't tolerate the food for whatever reason. So, some people don't like, they're texture sensitive. So they don't like mashed potatoes. So they're intolerant to things that are squishy like that or something. You know what I mean? But an allergy is something that is going to cause some sort of, so it's hives. Some people just get hives. Some people, like me, your throat starts closing and you go into anaphylaxis, stop breathing. Some people, I think they turn red. They just turn red when they eat whatever. So these are people who clearly, they know that this is a problem, but they don't have a problem with that. So I'm like, well, as long as you have a problem with that and you know it's not going to get any worse than that, great. I know for a fact that this is what happens to me. I've had it happen a few times, and I'm like, it's okay. I just can't eat it, and I'm okay with that.
But what food allergies are on the rise? And why do you think that's
I think
occurring?
It's because of all the chemicals we're putting in our foods, unfortunately. Yeah.
Yeah.
The food is not as pure and as wonderful as it was for our grandparents and great-grandparents. And, just like I think, the stuff that they ate back on the plantation is not necessarily what we should be eating today, because we don't work in the fields all day long. So we're not burning it off like they are, you know what I mean? So I think that applies also with the food allergies, because those foods were really, if you think about it, they were whole foods. They were pulling it out the ground and making it,
Well, I just say, what happened to that? I know my father and his friends, they all had gardens.
And, I'm really excited to say that here in Chicago, I see so many urban gardens, and I love it. I love it. My friend, Natasha Nichols, has We Sow, We Grow, and she has chickens and, in the city. And
fresh eggs.
Yes. Fresh eggs, and she's actually expanding. I forgot what she's expanding with this summer, but she's supposed to be getting more stuff. But she's feeding her family, and it's a community thing. So, it's not just her. And then there is a produce truck that comes on 43rd, I want to say it is, and they actually give you a bag, and you get to fill that bag And when I saw, it was a long line.
We need
and I
that
was
information.
I was visiting my friend at work or something, and I was looking at these people's bags, and I was like, what did you just say now? She's like, they fill the bag. And I was like, that's a lot of stuff. Like, I'm a single person. I was like, that's going to feed a lot of people. Yeah. And this was fresh produce. And because they know that it's kind of a food desert in that area, and you can't get fresh vegetables and fruits. And, I mean, at this day and age, with high blood pressure being on the rise and, high cholesterol, we need to eat as fresh as possible. And so this is the way that the community is trying to help us.
There's lots of buzzing and talking about this food initiatives.
Oh, yeah.
And yes, lots of it. Right nearby at University of Illinois, they're really looking into ways to feed people in a healthy, whole foods.
And I mean, like I said, I like the gardens because they really do make a way for you to get access to the stuff. Even if you had to buy it, at least you know exactly where it came from. It's not a question. There's no pesticides being used. You know exactly it came from down the street.
So, doctor, are there any preventative measures that we can take? Is there any lifestyle changes, anything that we can do to help ourselves?
Not really when it comes to asthma. But what you can do, like I said, once you have a diagnosis, the key is to avoid your triggers.
Right.
So that's me. I haven't had an asthma attack in a very long time because I avoid my triggers. And I also know that I know when I'll be triggered. So like change of season. So a few weeks ago, I started taking my antihistamine to make sure that the change of season didn't bother me.
That's a word for somebody who's listening. It's time to turn the medicine on.
Right, yeah. So, my doctor, and please talk to your physician, but he said, here's the prescription. You start before you need it, and then you won't have a problem. Right. And he was right. And so that's what I do. So the really biggest thing with asthma is just avoid your triggers. Once you know exactly what they are, avoid them.
Are there any emotional, any social impacts with living with asthma?
So, because I was born with it, and because my mom was a respiratory therapist, my parents, the way they raised me, I never felt any limitations on my life. I always was like, well, I'm going to do this, I'm going to do that. Now, what my mother didn't tell me was she didn't think I could go away to college because I was so sickly. But I did. And then I left the country and lived overseas for 3 years. So...
Did you have any episode in that 3 years?
No. Okay. And I lived on an island for 2 of them. Seafood was all around me. I'm allergic to seafood.
Oh, wow. Wow. That medicine was working. Yeah. Yeah.
So and actually I have it. My allergen is I can't eat it, nor can I smell it cooking. So but I survived. I was fine. The biggest thing is, some kids, because I think the anxiety of the parents kind of gets put on the child, and so the parents are so anxious because, my mother's a respiratory therapist, so she knew what to do. But if you don't have a clue and you have no medical background, it can be very scary for your child to stop breathing. Yeah.
Oh my gosh.
Yeah, everyone's panicking. No one can keep calm. And my mom, because of the fact that she had the training, she easily was calm, and she, like I said, she had to perform CPR on me. She brought me back, and then she said they were at the hospital, and my grandmother came, and my aunts came, and she said, and once everything was okay, that's when I broke down. Because she realized what happened. Yeah. So, so kids need to, you need to educate the children on asthma and allergies and know what to do if something happens. If they know what to do, they'll be calm and relaxed about it. If they know what they're allergic to, they'll start to ask questions.
That's right.
And they'll say, hey, what's in this? And I mean, like I said, I've been born with this, so I was always knowing. And so at 5, I would say I can't eat that because, my mom said I can't, or I'd ask them what's in it. You have to, the more they know, the calmer they'll be about it.
And the whole idea of smelling something and that being a trigger, that's very interesting. My daughter,
there's some people airborne with nuts too.
Peanut butter.
See? Yeah.
That's it. It's over.
Yeah.
It's, I smell peanut butter, it's a problem. Dr. Renee, can you please tell somebody how they can find you in the future? Because somebody wants to know.
I am everywhere at Ask Dr. Renee. So on Instagram, Facebook, my YouTube channel is Ask Dr. Renee, Twitter, Snapchat, TikTok, Pinterest, everything Ask Dr. Renee. My website is askdrrenee.info. INFO, because I'm a resource with a lot of information. And you can find my books on Amazon and on Target.com, Walmart.com, a bunch of them. And it's the author is Dr. Renee Matthews. And my one book is No, Renee, You Are Allergic. And the other one is Mommy, I Can't Breathe, The Modern Guide to Navigate Allergies and Asthma.
Wow. You guys, I do it every time. I bring you the best of the best. Thank you so much, Dr. Renee, for stopping by. She's a real doctor, you all, with some real information. And Dr. Renee, you talk about other things besides asthma.
Oh, yes. A lot of the health disparities in our community.
And there are a lot. I just want to thank you for stopping by. Make sure you come back again. We'll be back April 23rd. We'll be talking about rewriting your life script and how you can change your life. I do my vision board every year. I encourage everybody to do that. That's one great tool to help you rewrite your life script. But until then, make sure you stop by next month. And until then, may the rest of this day be the best of this day. Thank you so much for stopping by. I'm Dana Devine. On behalf of Equal Hope, if you need your free mammogram, cervical screening, or primary care appointments, please call us 312-942-3368 or visit equalhope.org. See you next time.